A highly contagious, drug-resistant stomach bug is spreading among Toronto's most vulnerable. There are 11 confirmed cases now of Shigella in the city, all of them among those who are experiencing homelessness. Infections can be severe, even fatal. The details from Jennifer Yoon today. More on the Toronto outbreak and cases elsewhere in Canada.
Night after night, Nurse Karen Al-Lamir is confronted with suspected cases of a highly contagious illness known as Shigella.
We've been seeing a lot of people coming in complaining of diarrhea, severe fatigue, belly pain. People are embarrassed. They don't necessarily want to talk about it.
There's an outbreak in Toronto. At least 11 confirmed cases among people experiencing homelessness. But the city's public health officer thinks the number is much higher.
Most people will resolve the infection on their own. So we're really only capturing those who are seeking medical attention, going to the hospital to get tested, for instance.
The best prevention for the bacterial infection is through hygiene measures. But for those without a home, access to public toilets is an ongoing challenge. In Edmonton, sanitation measures have helped control cases. Since 2022, over 300 people have been hospitalized there with severe Shigella infections. Public health authorities were helping people find a place to take a shower, use the washroom, and get a change of clothes. But still, there's been an outbreak on and off for years.
As soon as you would get somebody to the right place, 3 more would pop up.
Antibiotics can help and were part of Edmonton's solution, supplied to people living in tents. But in other cities, the stomach bug is getting more resistant to pills.
And if they require antibiotics, they have to either go to the emergency department or go to the hospital to be able to receive IV antibiotics.
And even then, IVs don't work in all cases. Extensively, drug-resistant Shigella has been reported in Europe, Australia, and the US.
There's been cases of it in Seattle, and we occasionally see cases in Vancouver, but luckily it's not that well established.
The best way to prepare against Shigella goes back to prevention. Jennifer Yoon, CBC News, Toronto.
Let's take a closer look at this story. As Jennifer has reported, Dr. Samir Gupta with us as usual for a Wednesday. He's a respirologist and associate professor in the medical faculty at the University of Toronto. Nice to see you again, and welcome back. So Shigella, again, Jennifer laid out certainly a pretty compelling report there, but just help us understand a little bit better. What is it?
Yeah, so this is a bacterial infection, and it's a common cause of diarrhea. Probably 200 million cases around the world each year. Often affects children. And so what's important for people to know about this infection is that most people will get over it on their own. So typically it lasts about a week, no more than a week in most people. You will get early on watery diarrhea, but eventually it can actually cause a lot of inflammation in the colon, and it can cause bloody diarrhea, mucousy, abdominal pain, fever, cramps. But again, most people get over it. It's the very young, the very old, the people with weak immune systems, the groups we usually talk about that we worry more about with this infection.
Okay, we'll talk about how this is showing up in cities across the country. Yeah. But obviously from those symptoms, it's a very unpleasant infection.
It's unpleasant, and what's challenging is that it's very contagious. And part of the reason for that is this particular bacteria is not very susceptible to the acid in our stomach, and that's how we disinfect everything that we eat. And so because of that, a very small number of bacteria can lead to infection, something like 10 to 100, which is just a tiny, what we call inoculum, which means it's very easy to have this on your hand and then inadvertently have, touch your food and get the infection.
So this is fecal oral transmission, is that what we're talking about?
Correct.
So in this particular case, where we're seeing it in Toronto, in the outbreak in Toronto, but in other cities too, Edmonton, Vancouver, some of the larger urban centers, it is exclusively in the populations of people experiencing homelessness. And why is that showing up there?
Yeah, so I mean, there are other cases as well. I think, there's probably been 100 cases in Toronto in the last couple of months, but there is a much higher number than usual in that population, in the homeless population, shelter, encampment population. And if you think about fecal oral transmission, you can imagine why that's a setting where it's hard to control that. you have shared bathrooms, you don't necessarily have good hand hygiene, particularly in encampments where you don't have running water. And then you don't have the ability for people to bathe. So it's not just the hands, it's you want to wash the clothes, you can't bathe. You often have common food prep. So if someone who's infected is doing the food prep, that becomes a problem. People are sharing utensils. So it's an area where it becomes very difficult to control.
So activists and community organizers are talking about prevention in terms of getting access to better facilities. That's obviously key in this particular story right now.
Yeah, I think there's prevention. There's already PPE being used by folks who work there. And then there's also the concept of treatment. And there's a lot of debate, and we saw in the piece about drug resistance. Often we call it XDR, extensively drug-resistant Shigella, which is resistant to many antibiotics, and it becomes challenging to treat. So we don't want to treat unnecessarily because we induce more of that antibiotic resistance. On the same side, you have folks who are susceptible and vulnerable in a place where it's spreading quickly. And we know that treating not only reduces the duration of the illness, but it will also reduce the period of time over which people can pass it on to others. Because many people, after they recover, will asymptomatically continue to shed the bacteria in their stool. So there's a period of up to 6 weeks where they can spread it.
6?
In some people, up to 6 weeks. So, and the theory there is that if you treat, even if the person is otherwise well and would have gotten over it, by treating, you reduce that period of asymptomatic shedding of the bacteria. And therefore, in that congregate setting where there's a high risk of spreading it, it may make sense to treat even people who are otherwise well, just to reduce that forward spread.
Okay. Obviously, additional challenges in that respect in terms of keeping this contained. You mentioned that it is affecting or does affect those in vulnerable populations. Is this something that is at risk of really spreading extensively through the general population, Dr. Gupta?
There are outbreaks every now and then. There are foodborne outbreaks due to produce infection. There are waterborne outbreaks, sometimes recreational water like wading pools, etc. But beyond those outbreaks that we sometimes see, there's no concern that we would see a dramatic increase in the general population. We wouldn't expect that. But in settings like nursing homes, sometimes child care facilities, anywhere where there's a common source, somebody doing food prep, for example, we worry, and this is one of those settings in shelters and in encampments, both. Yeah.
Thank you, Dr. Gupta. Good to see you. We'll see you next time.
Thank you.